Good morning, everybody. It is Monday, and so here I am doing my video again. I'm coming to you here from the Philippines. I'm Dr. Shalona McFarland, and this morning I thought I would talk to you about aging and chiropractic. So, when is a good time to get chiropractic care? Today. Doesn't matter what age you are. Everybody can get chiropractic care no matter where you are in your journey. Of course, the best time is the day you're born. That would be a great time to start chiropractic care because that way you're going to be able to get through life a lot easier. So with kids, we can help things like chronic ear infections, colic, bedwetting, all those sort of things that as the child grows, if they're not crawling correctly, those are all things that can be corrected easily as the child grows. Obviously, in the adult years, when you're working and doing really heavy physical labor or lots of times at a computer with really bad posture, those are obviously good times to have chiropractic as well. Now, as we get older, as we age, should you get chiropractic? Yes, absolutely. My grandmother just turned 102, and if I lived in the same city with her, I would be adjusting her. I have had patients that I have adjusted into their late 90s, early hundreds. I've adjusted people through cancers, through all sorts of different autoimmune issues, aging issues, osteoarthritis, degenerative disc disease. Those are all things that chiropractic can help with, okay? So this chart behind me here, this kind of shows you, this isn't normal. The normal's over here, you can't see it. But normally we would have a little bit of curve in that cervical spine. But as we age and things happen like auto accidents, falling out of trees, getting in fights, getting hit, all those kind of things start to take its toll on the curve of the spine. And so, especially the cervical spine. So this would be a post whiplash or a post this from the time year 2. Okay, it's not good to have children on those stupid things. It's not a good babysitter. It's a really good way to completely destroy the body. Okay, the things that this area innervates, the nerves in the cervical spine here, innervate your eyes, your nose, your mouth, your ears, your brain, the upper body, that basically. For instance, Christopher Reeves, he had a burst fracture. Not very many people survive those, but he did. A burst fracture is when this 10-pound bowling ball drops onto the little bitty atlas bone that holds the skull up, okay, and it bursts it. Usually what that does is it drops this bowling ball onto the next one down, which is the second cervical. Well, what's inside of those two is your medulla oblongata, which is the brain stem. And once you crush that, you're pretty much done. The brain stem controls everything from here down. That's why it's so important to go to someone who is actually trained as a doctor in chiropractic. Not just Joe Schmo down the street who said, "Oh, that looks easy, I can do that." Yeah, don't do that. That's not a good idea. Okay, so this is like in your up to your 20s. Usually this kind of damage can happen. It can happen at any time, but if you're looking this way at your 20s, you're headed to this one. Now this one, again, it's a little harder to see, but there's some degeneration starting to happen in here now. This would be phase 2. This is like 20s to 40s. You start to see degeneration happening, and you'll start to notice things like difficulty breathing, tearing up your joints a lot easier, the core is going, all of those kind of things start to happen when you start to lose that cervical curve and start to get degeneration in there. Okay, this one here is phase 3. This is usually 40 to 65. You'll start to see bony changes. So bone spurs. I know it's hard to see, I'm sorry. But there's bone spurs in here that are starting to stick out front. Okay, some people have spines like this at 20. Depends on what they've done. If they're big into heavy duty sports, Olympians, motocross, bull riding, things that like give you serious whiplash every time you go out there, then their spine's going to look like this a lot earlier. Okay? All right, and then phase 4 is the elderly population, 65 or older usually. And you can see that you can't hardly see any spine there. It's because there's so much degeneration. The disc spaces are almost gone, pretty much non-existent in this poor person. Which means their vertebrae are basically fused together, so there's no motion. They're stuck in whatever position they're stuck in, and they're not going to get much back. However, chiropractic care can help that too. First off, we can help prevent you from getting there, because if you stay mobile throughout your life, then these kind of things don't have to happen, because you're actually taking care of your spine as you go. But secondly, if you are already here, I'm backwards, my hands are backwards. If you are already here, then that doesn't mean you're dead. You still have function left, and your nerves are still in there. They're probably getting impeded a lot, but that doesn't mean it can't be relieved, okay? Especially since I do acupuncture and ultrasound and EMS. Hi, Anita, by the way. And a whole lot of other things. Hi, Suzanne. Hi. Haven't seen you in a long time. But especially since, if you can combine chiropractic with some of these other holistic healing opportunities, then that's going to keep you out of the surgeon's office for things like this. Because if you go to a medical doc, they got 2 tools, drugs or surgery. And you're going to fit into one of those 2 tools. If they can't figure out what's wrong with you, you're crazy. It's all in your head, which is not usually true. Okay, so trust your instincts, trust your body, what it's telling you. Think a little bit. If the doctor is saying, well, gee, you stubbed your toe, I think we need to do surgery, does that really make sense? Is that really what you need to do? So think about what is being said. Think about what is wrong or what is potentially wrong. I always recommend getting multiple opinions, especially with something really big like they're wanting to do surgery on your spine. Well, let's get a few different opinions on that and see what the consensus is rather than this one person's opinion. Because a lot of times that one person's opinion is based on how many bills they have to pay, unfortunately. Here in the Philippines, they are very C-section happy. I do not understand it. Probably 90% of the ladies I see have had C-sections, multiple C-sections. And that is just horrendous. They're being told they're too small to have babies. Not true. That, I don't know, they come up with all sorts of different excuses for them. And that's all they are, is excuses from what I can tell. There's been very, very few ladies that A, have even known why they got a C-section, or B, got it for a legitimate reason. So, ask questions. Be that obnoxious patient that's like, hey, wait a minute, is this really what is necessary? Like, you go in to get your annual exam here, and they always find some excuse of, oh, you have 1 molecule of blood in your urine, you have an infection, you need antibiotics. A, I'm female. B, 1 drop of blood does not mean I have an infection. They've done nothing else to determine that. Ask questions. If it doesn't seem legitimate, maybe it's not. Go find somebody else who can give you a different path to look at least. Okay? But as far as older patients, yes, absolutely bring them in. Doesn't matter the age, 85, 95, 100. I'll adjust them all. I have no problem doing that. Unlike medical docs, have a multitude of tools that I can use to help create a healthier life for everybody. And it's because I didn't go to school to learn about drugs and surgery. I went to school to learn about how to heal the body, and that's what I do. So hopefully that answered some questions today. Hi guys, it's lovely to see you listening to me from back home. I know it's late there last night. But hopefully that gave you something to think about. And if you haven't been in to see the chiropractor yet, the doctor of chiropractic, go find one. Go in, get adjusted, get some relief, see what it's like to live pain-free. Suffering is optional. We don't have to suffer. Alrighty guys, love you. God bless. I will talk to you next week.